given 4 or 5 months pregnant. I'm going in less than 12 hours. I was nervous, but now I'm just like walking in faith. Some of my wonderful surgery sisters, the owner of this recovery house, my few friends that I told and were supportive of me doing my surgery, they contact me and they just spoke life and positivity into me, and that helped so much. It helped my mood tremendously. So now I just feel good. I just feel calm. I feel at ease. I feel safe, protected, confident in the doctor and his abilities. And I am going to continue to pray and speak life into myself and into the doctor. I need him at his best because I am coming at my best. I worked hard to get my stomach like this. I worked hard for my 22 pounds. I had to gain 22 pounds for this surgery. I started gaining in April. And by November, like the first week of November, I hit my weight goal. So that was like 7 months. You just force yourself to eat more. Literally, you have to force yourself to eat more. Take it in strides. Don't just like jump into it. You gradually increase the amount of food that you eat. And then eventually it'll go from, okay, I'm eating bigger portions once a day, eating bigger portions twice a day, eating bigger portions 3 times a day, adding in meal replacements such as like snacks, like fatty snacks. So it could still be healthy, right? Like there's avocado. I actually don't even like avocado like that, but just an example, avocado is a healthy but fatty fruit that you can still eat and make guacamole and eat some chips with it. But then for me, what I did specifically, I just added shakes, protein shakes, like high calorie protein shakes. Yeah, I remember that video Cash Doll did that showed her age, was doing the stomach rolls, and then the hip bouncing. Yeah, when I put this on, I didn't even really watch the pattern. Butterflies represent resilience, they represent transformation, growth, beauty. Like, wow, I put this on coincidentally, but it matches my journey so perfectly. It's 5:20 a.m. Dominican time. I just finished showering with the Hibiclens for the second time. This is what I'm wearing to the doctor's office. I want to be comfortable, so I'm wearing something loose, but I also didn't want to expose too much of my skin, being that I just cleansed and sanitized it. So I put on this big nightgown, my leggings, and I have on some socks. And I'm gonna just wear my rubber slippers. My bag is packed since like Friday. I think I'm gonna take this out though. And I'm gonna keep my board that goes here. So that'll help sculpt this like tailbone area. And my wipes. My tank top to wear under the faja, compression socks. I want these to compress my arms since I'm doing arm lipo. I have my charger. I have another like nightgown like this. It fits exactly the same. It was a 2-pack that I got from Amazon. I think I got this from Amazon, but it was a 2-pack set. Same size, same fit. It's just a different pattern. I bought Tylenol PM. I bought it still. I know they're gonna give like medications via IV and, you know, IV drops and all of that stuff, but I bought that just in case I need an extra little boost. These are tape, medical grade tape. I bought like 10 pads, maxi pads. They go under the faja. The tape is needed because I have the lipofoams that are gonna go around my faja for added compression. I have enough to put around my arms as well. I put my handy dandy notepad so I can just take some notes, journal, vent, detail the process in writing. I bought gauze sponges. I don't know for what, but I bought them. They might come in handy. These honey lemon echinacea cough drops. Supposedly, I heard like a few people say that your mouth gets really, really dry post-op. In fact, my mouth is dry right now already. I wish I could eat one, but I don't think I can. I ain't gonna take no chances. But I bought these for post-op to relieve like any dry throat, dry mouth symptoms that I could potentially experience. I bought lip balm. Again, you know, if I'm having dry mouth, the lip balm is gonna help keep my lips moisturized and plumped and kissable. Even though there's nobody here to kiss me, but it's all good. My lips still gotta stay soft. I bought some gum for after, again, to help relieve dry mouth if I get that. And I bought some unscented travel size lotion. Gotta keep the hands moisturized at all times because something that I noticed in showering with the HibaCleanse these past few days is that it really dries your skin. Like, normally when I shower, I'm ashy if I don't moisturize as soon as I get out the shower. HibaCleanse, that ashiness is times 10. Plus, you feel the dryness, you see the dryness. So, I just bought some lotion just to help with the dryness post-op. So yeah, that's pretty much it in my bag, of course. Big old boppy pillow. I am also going to suggest bringing an extra blanket because your hemo and your iron is already going to be low after surgery. So that means you're going to be cold after surgery, colder than normal. And so out here, I noticed the blankets are pretty thin. So just in case the blankets are too thin for my liking, I'm bringing an additional blanket so that I could keep warm and be comfortable and cozy as I recover in the room that I'm gonna be in for 24 hours post-op. So that is my bag, my overnight bag. I'm 10 minutes away from the clinic. My only concern is that I'm still congested and coughing. Not me tripping. Oh, Lord. At least I'm in a medical facility if I fall. I already said a wonderful prayer over me and my doctor this morning. I blessed his hands, his mind. I blessed his focus. I prayed that he's alert, awake, aware, focused, remembering what I am asking him for. One of my surgery sisters reminded me to even pray over the cannula that he uses, and I thought that was really, really equally important. So, oh Lord, I'm out of breath. Imagine that. One flight of stairs got me out of breath, and normally I'm running up these joints. That's what nerves could do to you, I guess. I love their Christmas decorations. It smells so good. Okay, so let me see if I can. Okay, so it's still closed. This is one of the reception areas where the nurses sit. Nurse Patricia is usually here. So this is the first floor. This door here that I'm focused on, this is where I did my specialist evaluations at the doctor's clinic. I believe I did the cardiology appointment in this room here. Obviously everything is closed right now because it's super early. Literally just me, the security, and my boppy pillow here right now. This is the room that I did my specialist evaluation, one of them, and then the other one was done upstairs in the doctor's office with the pulmonologist. And both are really quick, really easy. Each one took about maybe 10 to 15 minutes tops. Okay. ¿Me prestas un documento personal, por favor? Cédula, pasaporte. So she just asked me for my passport, form of ID. So I'm grabbing that now out of my bag. So right now they're just checking me in. Thank you. I actually just saw another doll waiting. She spoke fluent Spanish, so I don't know if she's from DR or what she's getting done, but yeah, there is only me and her waiting to get our surgery. Obviously, I'm going first. I was told that in the mornings, the doctor does surgery, and in the afternoons, he does the consultations.
Se coloca por favor estos zapaticos en los pies, okay. Este gorrito en el pelo y esta batica con el abierto hacia atrás.
Okay.
Por favor, ven un momentito para colocar los sueritos.
Okay. It's kind of big. This is where I'm gonna stay and recover overnight. I have a TV. It's pretty spacious. I guess my nurse is gonna be here. Okay, okay. This looks like a closet. Okay, there's a bathroom. This is cute. Me gusta. Okay, and they have a safe. I wouldn't trust it because they probably have a backup key, but they have one, you know, so maybe you could try to. Oh no, but this one is a code. Yeah, this one you enter a code. Okay. All right, cute. And then there's the fridge. That's nice. Oh, I should have brought Ensures. I don't know.
Alcohol,
No.
coffee.
No.
Do you have fake dentures?
No.
We had to ask. Private. Okay, so what would happen now is that after she puts the IV on you, the doctor will come, mark you down. You guys will have a really good talk about what procedures are actually having done. Yeah, you've seen him before, definitely. After that, we will give you a blue pill. That blue pill is gonna make you relax. It's not gonna make you like completely sleep. Then the doctor will come, the anesthesiologist will come. They'll put you under here. Okay. Then once they take you to the operating room, they will have an epidural blockage, which you won't feel anything because you will be totally sleeping. After that, she'll be with you every single second throughout the whole surgery because you know it's gonna be a machine. You're gonna be hooked up to machines, and she's gonna be right there with you. After the surgery is done, you will be taken to the post-op recovery, and after that, then you will be coming here.
Okay.
So you won't remember anything. Do you have any questions for her? She's the anesthesiologist, though.
Not yet.
No. Just sign here saying that everything you said was truth and only truth. Vamos a ponerte la vía de una vez.
When I came like to DR, I did develop like a little cough. Nothing crazy, and it's a dry cough. Like my throat just feels scratchy.
Do you still have it though? You feel it still have
My throat isn't scratchy, but I did like cough this morning.
Okay.
But that's pretty much it. Like
okay.
So
Thank you for
that's
that info.
something
It's really good to know. Let me tell you
yeah.
that. Ella dice, cuando ella llegó aquí, ella desarrolló una pequeña tos seca, pero que ya ella como que no la tiene. Ella se levantó y tosió un poco en la mañana, pero que no ha vuelto. Okay, dile que no se preocupe. Looks like you're going to be medicated with something extra just in case.
Okay, están limpios con todo y todo, o sea, perfecto.
Vamos a cambiar la bata, o sea, vamos a ponerle en el chile. Te ayudo. La voy a soltar aquí y la vamos a poner así. We don't turn the AC on. The doctor doesn't like it, okay?
Okay.
Just, that's a little hot right now.
Yeah. No, I don't mind.
¿Hace cuánto tiempo el tatuaje de la espalda? How long your back tattoo? How long was it?
7 years.
I'm sorry. 4 years.
Oh, okay.
That's fine. Okay, you can lay down now. They're just gonna put the IV on you right now.
Okay.
And these are from my feet. Yeah, correct. But you can wait until they put the IV because she'll put the IV and then the doctor will come.
Oh, I forgot to take off my panties.
No.
Okay.
Oh, you gotta float
Oh.
the chocolates, yeah.
Okay.
Yeah, the IV is on your hand. Close your hand, please. Close. Mira, ya tiene la vena dobla.
Ay, sí.
Sí, pero se puede poner ahí. No te muevas, por favor. No me pase acá. Sí, abajo hay uno.
Mira, respira profundo. ¿Cómo se dice eso, bro?
Take a breath.
¿Qué pasó? Porque yo estoy aquí.
How was it? Is it okay?
Painful.
It's sadly for surgery we use kind of like a
Espérate
big
que
catheter,
Yeah.
which is
Humano.
what it should be in case.
Ponle abajo.
No, pero voy a ponerlo.
Ok.
No, pero antibióticos. ¿Qué andamos haciendo?
Baja los piecitos. Ok. Vamos a poner el otro ahí y acabamos.
They're literally almost done. I will be back with a few meds
Ahí
that I
está,
need
ese
to get
también.
over your IV, okay?
Okay.
Which is our 2 antibiotics and 1 med is for
Antibiotics.
blood clots.
Okay, great. Being that I'm this like big time, critically acclaimed, highly favored, highly recommended YouTuber now, one thing I appreciate about this room is that the bed is literally right next to an outlet. So I just got up and maneuvered with the IV in my hand. Still, I maneuvered to the closet and I got my bag. Oh, and yes, y'all, I do, like, this is a habit of mine. Everywhere I go, if I'm staying, I don't care if I'm staying for a day or two, I unpack everything and I put it in the closet and I organize it. So I left this closet open so they could see all my stuff is out. They don't have to go into my personal bag for anything. I better not hear that zipper open because y'all don't need nothing. Everything is laid out for y'all. Yeah, I love this room because of the close proximity to the charger. So my phone is now connected and powered, and I won't just be draining my battery while I'm waiting to be seen by the doctor. So that's a big plus because I did bring an extension cord, and I still do recommend you ladies to bring an extension cord, but I forgot to take it out my suitcase.
Sí. Ay, me lo saluda él. Yo, mira, nosotros tenemos 1 año y pico tratando de llevar una caja, un regalo, un vino, una cosa.
Ah, no puedo mandar conmigo.
Ah, bueno. Sí, sí, estaría bueno nosotros llevarlo porque por agradecimiento y eso.
No, y siempre está de noche ahí.
No, él trabaja mucho. Siempre está acá. Come here, please. Stand up here.
Ah, que yo estaba poniendo la cámara.
Ah, you want to? Ah, you want to?
I was trying to get a good
Bring it.
angle.
Yes.
King of content.
I think there will be good.
Okay, alright. Contenido.
Yes.
Okay.
There's a contenido.
Hablaré del contenido.
There we go. I'm the king of the contenido. See, I try to be good on social media, you know.
2 thumbs up.
I work
You're
in
doing
it.
great.
Yes. Put your arms like this. Thank you.
I'm so used to sucking in my stomach.
Yeah.
I don't have to do that anymore.
Stand up there. Put your arms. Él es muy bueno.
Okay.
Él,
Sí, realmente nos ha gustado mucho la atención.
sí. ¿Y cómo lo conseguiste? Por la.
Las redes.
Sí.
Okay.
Yes. En las redes, sí. Nosotros lo conocimos de casualidad.
No, yo, parte de personas que sigo, andaba luz con él y lo recomendaban por eso.
Sí, él es muy bueno. Okay. Sit down here, please. ¿Sí? Sí. Mira la puerta.
Morning, how are you?
Do you know? She is Christian.
Oh, Christy! I am good. It's
Nice
so
to
good
meet you.
Oh my God. Christy, you're like an earthquake. You knocked out everything.
No, sit
Oh.
in the corner.
Oh, yes. Okay.
Put your arms like this. And.
So when I did my consultation too, I was extremely nervous.
Yes.
It's like you meet a celebrity or something. So I do have some questions. I don't know if you have the time to answer.
Right now?
Yeah.
Yes.
Okay, so
You can.
okay. All right. So for the tummy tucks, because I've seen girls who are bigger than me with more belly, more stomach, and they just need lipo. So what to you?
They just need lipo.
Yeah, like girls with bigger stomachs
But
or like
with me,
more.
they do
No. In
surgery.
general.
In general.
Yeah, like they might be 100 pounds more than me,
Oh, wow.
higher BMI, and
Okay.
they just do lipo. So I just wanted to know, like, as a doctor, what to you is an indication that somebody needs tummy tuck or mini tuck?
Oh, mini. Okay.
You can speak in Spanish too.
Yes,
Yeah.
you will understand.
Yeah.
Una cosa primordial es esto. Este es el colgado, es tu abdomen. La caída y el excedente de piel, porque esto es como una bolsa, ¿me entiendes?
Más o
It's
menos.
like a bag.
Yeah, the skin.
Yes,
The
you
sagginess.
have something inside.
Got
When I
it.
take out all the fat,
Mhm.
there be empty,
Right.
and this skin gonna be
Sad.
sad. Yes,
Yeah.
and I don't want that. That one thing that I take
Serious.
yes. But to do a tummy tuck, I take that and the rectal abdominal, the diastasis.
Right. The diastasis.
Diastasis.
Mhm.
And to make sure that we correct that, I have to do a tummy tuck.
Yeah, the muscle repair too.
The muscle repair.
Right.
Yes.
Okay.
Estamos con esta paciente a quien el día de hoy le vamos a realizar una lipoescultura con una mini abdominoplastia. ¿Te puedes stand up, please? Ella tiene este excedente de piel, pero debajo del abdomen, entonces le vamos a hacer la lipoescultura y una mini abdominoplastia. En unos momentos le vamos a enseñar los resultados. Okay? Dame.
And I had a guess, because they said you like the room hot. Is that because it's easier for like the body to warm up and the fat comes out easy? When the room is hot.
¿Qué dijo, querido?
What was the question? I was saying the room is hot. Is that because
That's-
the body temperature warms
Yes,
up?
I like to
Okay.
I always tell my nurse
Mhm.
that keep the room warm
Okay.
because it's good for the patient.
Ah.
I try to, it's part of my protocol. That's one thing is keep the room warm, and other thing is keep the surgery room warm. I sweat a lot.
Oh
I
my
prefer that because you're gonna be, ¿cómo se dice desnuda? Without clothes. So you're going to be naked in the surgery room,
Yeah.
and I got to use liquid
Mhm.
on your body.
Oh, I see you spray.
I use
What
I,
is
I
that?
use solutions,
Okay.
and I use a tone solution that go inside to your body.
Ah.
Yes, to do the lipo,
Oh, cool.
and that's produce the anesthetic produce low temperature.
Okay.
Your low temperature is that you're gonna be cold.
Yeah.
Even you don't feel it, but the body feel it, and this produce a stress on your body, and that stress produce some hormone like cortisol and all that doesn't help us.
Okay.
And that's why I prefer in the room warm, surgery room warm,
Yes.
even I sweat.
Yes. Okay.
The principal thing on my surgery is you, the patient. I don't have to be comfortable.
I love that.
The patient, even is sleeping, have to be comfortable.
Okay.
Hormonal, principle, hormonal, because you don't want to feel anything.
Right.
You don't know if the room is cold
Right.
or if it's warm.
Yeah, I'm gonna be sleeping.
You're gonna be sleeping, but the body feel it.
Right.
The body feel it.
Yeah, because the nerves, your brain is still
Your
awake.
brain is still, and you're gonna produce some hormone that don't going to help us. That's good question. That's a good question. I have to do a content,
Oh yeah,
about
you were
that.
telling me.
I will have to do that because this is important. It's part of my protocol. It's we are. I have to do something about it. I have to,
Yeah.
because there are some things that I take to the patient be safe.
Okay.
That one thing, and you're gonna have a socks,
Okay.
and then inside you're gonna have a bone socks too.
Ah.
That you're gonna be lay down,
Yeah.
but these socks do massages that do
Nice.
the fluid your
The circulation.
circulation,
Yeah.
the circulation.
Okay.
Yes.
Oh, but that's so cool.
Yes. I'm gonna start to use ¿cómo se dice manta?
Like a warm one, like that one, la que es caliente.
Yes.
Mhm.
You're
I'm
sweating.
sweating already.
Yes, yes, I know.
But it's from nervousness.
Yeah, and the warm too. Yes.
My main concern,
Maybe.
as I told you, my stomach,
The hips.
the hips too,
Yeah.
yes. But speaking of the hips, I don't know if you can see it, but I have scoliosis. I don't know how you say
Yes,
it.
scoliosis.
Oh,
The
okay.
same word.
Same.
Yes.
Right. So, how do you deal with making the hips even on people that have a curved spine and they stand?
But you're gonna be laid down. The scoliosis don't gonna affect me. You know.
Right. Okay.
The thing is that when I do the lipo,
Mm-hmm.
you have a scoliosis.
Yes.
Maybe some people, your friends,
Mm-hmm.
doesn't notice.
Yeah.
But when you have the lipo, it's noticed a little bit
I
more.
know.
It's gonna be a little bit more. It's gonna notice.
So, and then I also wanted to know, I saw like some girls, the bed, it moves, like it bends, you know?
Like in the surgery room.
Yeah, the surgery bed, like it goes up a little bit, like it, I'll show a picture.
Okay.
Yeah.
¿Qué dice?
Es algo como de que hace una paciente en la sala de cirugía.
It's not flat, like the bed can move.
Que las camas como que las camas se mueven.
Sí.
Yeah, so
¿Y qué pasó más?
when you move the bed up, like when it's not flat, how does that help you?
Que como para que
Is
se
it
la
for
mueve para
perspective?
arriba, para abajo.
I'll show
No
a
entiendo
picture.
la pregunta.
Yeah, I'll show a picture.
Yeah. You don't have kids?
No, ninguna.
You plugging?
Yeah.
You have to be careful because when the patient do the plastic surgery,
Mm-hmm.
the sexual relation is that good?
Mm-hmm.
The sexual relation go off.
Really?
Yes, because you're gonna be a new person. You're gonna have more ass. You're gonna be have and there is 90% of
Mhm.
patients that do plastic surgery that get pregnant. You have to careful. Be careful, you. The man never, never be careful.
Oh gosh.
You have to be careful. You have to use your planification. You're gonna have a good ass, good hips.
Yes, you're gonna sculpt me.
You're gonna be more
The temptation.
attractive. Yes. The man, when you're sleeping, gonna see all that meat, and
Oh no.
yeah. I hope that don't be recorded.
I can take it out.
No. That's kidding.
You have a great personality.
Oh, thank you. Thank you.
And,
And I'm not acting. That's how I am. Yes.
oh, okay. You see how you lift it?
Yes.
Is that possible?
Yes. That's why I do it.
Okay.
Because that's where your butt's gonna be. Where it's gonna be.
Okay.
You see this
Where?
projection?
Yes.
That's what I draw in.
Oh,
That. Yes. You need more butts here.
Right.
Yes.
And in the middle.
Here, this part gonna give you more projection, more,
Mm.
and from here the hips.
Oh, beautiful.
Hips.
So, okay. I was scared that if you add more fat to my butt, it's gonna drop.
No, that's a good question too, because I put, the house have pillars.
Yes.
The butts have pillars too, and I do this part to your butts go up.
Okay.
When sometimes patients don't have a lot of fat, and I put pillars on the butts, and the butts look more high
Right.
because I put pillars.
Right.
When
There's a support.
when the doctor don't do that, the butts go down because you have more fat, and the butts going to be more down.
Debajo.
Yes. And this line
Yes.
gonna be here when the butts go down.
Oh.
Yes, this line is
Everything
this line.
drops.
You see this line,
Yeah.
the butt. You end here is good,
Right.
but some people that have the butt down,
Yeah.
the line
It goes down.
goes
too.
down. Yes,
Wow.
that's good question. Yeah, you have to be interviewer. ¿Cómo se dice? Una entrevistadora. ¿Cómo se dice entrevistadora?
Yeah, I would love that.
You have a YouTube channel.
I do. It's all over the place. It's random things.
I hope they understand my English.
Oh yeah.
I only have 100 megabytes of English, and it's ending.
No, your English is excellent.
Yes.
Muy excelente.
Okay, wait. I try.
And you learn English just
When I was kid, I know more English, but I didn't practice.
right. Okay.
When I was like 14 years, I know more English than now because I studied English there in that time, but I didn't practice till today.
It's okay.
But I used to know more English.
So when did you decide you wanted to be a doctor and a plastic surgeon?
I decided to be a doctor because when I was kid, I lived my grandmother. My grandmother was a nurse.
Me too.
My mother started to study medicine, but she didn't continue because she got pregnant with me, and I think I want to continue
Yes.
to revenge my mother. and I studied medicine. Then I decided to be a surgeon, not plastic surgeon. I decided to be a surgeon because I like it. I like to do something with my arms, my hands.
Yes.
Because I don't like to be a clinical doctor, because I don't like to be sit in a chair.
It's boring.
It's boring. and I decided to be a surgeon.
Okay.
And then we're in the surgeon resident. I decided to be a plastic surgeon because I think I like the beauty of the body, and I like that.
Okay.
Yes.
So you got the history of this amazing doctor.
Yes. You will see her result. She's gonna be very beautiful.
Do I need to show you the picture again?
Yes. Show me if you want.
Alright, so I'm gonna start recording. I feel woozy. I just coughed like 3 times though. But the anesthesiologist did say she's gonna put a little cough meds in my IV to assist with that. So I have a timer running. And the timer is basically from the time I started feeling a little woozy to the time I knock out. But I don't know how it's gonna stop if I'm... How is the timer supposed to stop though if I'm knocked out? We'll find out on the next episode of Dragon Ball Z. But yeah, it's definitely kicking in. So they're switching me to this side. That's gonna go into the operating room. So I am awake. I just did my surgery with Concepcion, and he is just a wonderful doctor. He's so knowledgeable, and he speaks English extremely well, understands it extremely well. And so communicating during your markup and your face-to-face appointments are gonna be a breeze for my English-speaking girls, because you don't really need an interpreter. There's always an interpreter in the room, but you don't really need it because of how well he understands and speaks English. Right now, I don't feel anything because I'm fresh out. It's to the point I didn't even know that I had a catheter and that the bag was full of pee already. My wonderful nurse, Patricia, she just emptied the bag, and it just shocked me. I was like, wait, when did I pee? Because I'm still thinking I have to get up and go to the toilet, and they were like, no, but you have a catheter and you have filled that bag up. I couldn't feel that I was peeing. Normally when you have to pee, like, normal, you feel it, like you do the potty dance. If you've been holding it for so long, I don't know, I didn't feel anything. So I wonder, is this gonna be the case, like, when I leave? Am I also gonna have the catheter, or?
No, you're
Okay.
not. The
All right.
catheter is always removed
Okay.
the next day, tomorrow,
Yeah.
after discharge. When the doctor says you can go, then we actually remove the catheter. You only go home with your drains and a pain pump if you decided to have one.
Right. And then, so I'll be able to feel when okay, so it's gonna be back to normal after today. I'm gonna be able to feel when I have to go. It's not gonna be a mystery. I'm not gonna be having urine-filled bags. So that was like something that just like threw me off, but I felt like you all should know. I also feel like you all should know my wonderful surgery sister is actually recording this right now. She is wonderful, so supportive, and yeah. And her surgery is coming up next. So I can't wait. Because I'm just chilling, literally just chilling right now. I have to take my medicine for inflammation next. So that's what's gonna happen as soon as I stop recording.
La doctora que va a hacer aquí con usted para darle seguimiento.
Wait, repetir?
Mi nombre, ella habla inglés.
Sí, todo en
My
inglés.
name is Rosamund.
Oh,
I am the doctor who's going to be there with you tonight
okay.
to take care of you.
Okay, wonderful. Thank you. Orina para mí. Eso fue, sí, pero ya salió. Y en verdad, yo se lo hacía 3 veces, yo se lo hacía 2 veces.
Angie.
Se lo fue.
200, 300 cada vez. So, yo creo que hay un redondeado de 800. El otro todavía sigue flaquito.
Como 800. Gracias.
So this is the heparin shot. We give this to every patient after surgery according to the doctor's order. The time might change. This will help you to avoid clots, which is very, very important. It itches a little bit. It's not very satisfying.
Turn my head.
1, 2, 3.
There you go. Oh, not bad.
Okay.
How was that?
I am that good.
Wow. Yes, you are.
There you go, Sadie. You go.
Yeah, I didn't feel anything.
That's good. She didn't feel anything.
Yeah, it felt like if somebody just did
Pinch
this.
you, yeah.
Yeah.
And I was doing that intentionally. Like I was
Oh,
pinching
okay,
you.
okay. Yeah, for that tension.
Yeah.
Okay.
The doctor just texted me if I did the heparin shot.
Right on time.
Nah.
The heparin shots, how often do those have to be?
So they have to be every day around the same time. So this time I gave you yours at 7, you might say. So the doctor will tell you how many shots you need in your prescription tomorrow. Even if you're not having surgery with Dr. Concepcion, it's extremely important for you to have those shots. Everyone usually in the world that has major surgery, plastic surgery is a major surgery, should have their heparin shot. It helps, and it helps the ability to decrease clots, and is very, very important for that, okay? It's so good.
Homemade chicken soup.
Yeah. Straight from a Dominican grandma. Just melted cheese on it. So real mashed potatoes. The Dominican potatoes. If you just got a tummy tuck and you feel like throwing up, which is perfectly normal, hold your tummy as tight as possible so it hurt less, because it will hurt.
Right.
You feel extremely tight, okay? I want to leave these here,
Yes,
bring you
please.
some nausea. Do you feel nausea?
I was just now, now that I burped,
Yeah, it just feels better.
yeah, it feels a little better.
Okay. What I'm gonna do, I'm still gonna give you something for
Okay.
nausea. If it's not necessary for you to throw up, then perfect. No, you're getting the action. There you go.
Oh.
See if I don't have popcorn.
Oh Lord. Hey guys, so I just ate like 4 spoonfuls of soup and a spoonful of mashed potatoes, and normally I am a foodie. Like I love to eat nonstop. I love food. And the little bit of food just now that I had, for whatever reason, it just made me feel so nauseous, like I had to throw up. So this is here in case I get that feeling again. But Nurse Patricia did say that that is a normal feeling. Luckily the bowl is empty, so obviously I didn't throw up. But what happened is I may have just had gas, which Patricia said is also Patricia said that's also normal. So I just burped like a few times and the nausea went away. But she just stepped out to get me a little bit of more nausea, just a little bit, she said, to help just in case. I was also informed that earlier I had omeprazole, but the solution in my IV. And what omeprazole does is it also assists with nausea, indigestion, and any GI issues that you may be having. So they gave me that in my IV already.
You want to see where?
Yes. So apparently I'm peeing.
Yeah, the color is good.
And
It means that you're
no
being.
idea.
Yeah,
I don't feel it. I don't feel the urge.
that's a good thing. There you
It's
go.
happening.
Is this your first time having a catheter?
Yes.
Aw.
Science.
That's what she's been doing.
Wow.
Okay, now we're gonna try the
It
pillows.
brought me up.
Yeah.
My back. Why is my? Oh, the
lipo.
lipo.
It hurts.
Girl, I think the
you
anesthesia
worried,
still has me a little woozy.
It's normal.
That lipo, that back is
I can't believe I
really
just
snap.
asked why is my back hurting after doing lipo 360, BBL. Of course, my back is hurting.
It's okay. I gave you some payments like no more than 30 minutes ago, so you should be
Okay.
feeling better, okay? 'Cause now I'm sorry.
Patricia, what medicines in our pain in the pain pump?
What medicine?
What? Yeah, like what do you put? Is it like the same thing that's in here?
Same thing with a little bit extra. I know.
Okay.
Oh,
I know. I'm sorry, sweetie. There you go.
ouch.
I know. I'm sorry. Feeling better?
Oh,
Yeah, I know. It's.
yeah.
There you go.
Oh, yes.
There you go. Your feet good?
Yes, my feet are good.
Okay.
I'm just gonna bring the bottom pillow down a little bit.
I know. I knew that was gonna happen, but I just need to make sure if you're good, because it's gonna
Yeah.
hurt you when I move you, but then you are gonna feel okay. Mel, you asked me about the meds on the pain pump. I forgot about that.
The
So
pain pump?
usually what they have, not usually, what they have is they do have a little bit of opioids.
Okay.
You can ask the doctor which opioid, because I'm not really sure. It can be a little bit morphine or yeah, it really depends on that. It has some, and it has other stuff for pain,
Okay.
and it has also a med that will help you with fevers. It's very normal for people after surgery to develop fever. That's just a body reaction. It has something for nausea, and it has a gastric protector.
Okay.
So I don't know how many of each of them it has,
Okay.
but I know that it has at least 2 or 3 pain meds.
Oh, okay.
Yeah.
So you highly recommend like the pain pump or?
To be extremely honest, if you can pay for it, that's amazing.
Right.
Yes, you do. But if you have to be considered on your first night. It will be such a good indication.
Okay.
If you have boobs with implants, think about it, because they hurt, and there's no way around it. Like there's nothing we can do because it's inside your body.
Okay.
We feel the pressure. It is so normal.
Okay, that makes sense.
Yeah.
One of the biggest things that I'm thinking right now is I just got fat put into my butt. Why am I sitting without my BBL pillow?
Obviously, yeah. So, I promise on my kid's life, it's not gonna get ruined. The thing is that you have a major scar, which is your tummy tuck. So this is more important. Tomorrow, after you leave with your BBL pillow, and you don't stop using it.
Okay.
What will give it shape is the faja and the massages. Mostly the faja for the BBL. You don't have to worry about that. So every single doll that you have seen here that has breast or tummy tuck has been laying down like you until next day.
Okay.
Yeah, it's just because of that. You have a major scar.
And no fat is gonna be affected. Like it's not gonna change the shape.
No, it usually it gets affected over time. Imagine that you sit on your butt every single day and don't wear the faja. Probably is gonna get affected. Yeah, definitely.
Okay.
Wear your faja. It's very important. She still wears. I'll give you the blue cap. Then I'll give you another payment. Okay. Tomorrow we're gonna take a blood sample to see how your hemoglobin levels are, and the doctor will decide if you're good to go, if you need some iron, or if you need some blood. Okay. While we're waiting for those results, the doctors, nurses are gonna come here and they are gonna do a dressing change, which means taking those pads under you, putting the faja, cleaning you up a little bit. I know that Dr. Laura said that you were gonna have your first massage tomorrow in here, which is pretty good. The sooner, the better. And we're gonna stand up around 6 a.m. Okay? We're just gonna walk a little bit, then come back to the bed.
Okay.
So that's how it's gonna go until tomorrow.
All right.
We take your catheter, as I tell you, and your IV before you leave. Okay?
Yeah.
Good.
Thank you. WTF. Waist is tiny.
Already,
And I see the hips.
And you're all padded up.
Oh my God.
Ooh.
Oh my God. I must have a heart attack. Oh my God. The hips. Oh Lord have mercy. Okay. I'm about to get too excited. I feel like I'm about to cry. Honestly. How much cheaper are the girls in DR paying
For Concepcion?
for like the doctors in general?
No,
Like,
they're paying the same as you. Don't even
just in
worry.
pesos.
Yeah.
Oh.
Yeah, don't
okay.
even worry. And we don't normally get plastic surgery. Like, people in DR don't get plastic surgery unless you live in the state and you make dollars.
Oh, then you come back here.
Or you have a sugar daddy or that's Yeah.
You know, honestly, I was
Yeah.
just telling them, like, when I went to the mall and stuff, I don't see any BBLs.
No,
Yeah.
it's not
Like, I
usual.
don't see any. So I feel like it's, especially because somebody told me a lot of the New York night girls come here.
Oh yes.
And
Oh yes.
go
But
back.
New York, you know,
Yeah.
people that make dollars, it's more
Mhm.
possible. It's not even logical unless you're stealing money from the government.
Mhm.
Like, in my salary, never in my life I would have thought of having plastic surgery.
Mhm.
Like, the reason that I'm having it is because it's extremely cheap for me. It's like almost free. But
Mhm.
Yeah.
taking outside of that,
You.
I would never ever think in this salary in my life. I don't even make $1,000, not even $700 a month. So imagine how much I have to save
Right.
for surgery. Like, it just doesn't make sense.
Oh.
And they all charge in dollars.
Mhm.
They
Oh,
just
yeah.
they just
Wait, what? So the girls, they can't pay pesos? The girls that's from DR.
I mean, we can pay in pesos, they just convert dollars to
Convert it.
pesos, and it's extremely high.
Mhm.
I know people that do it, and they get a bank like a loan.
Mhm.
A loan.
Yeah, people get like
Wow.
girls who are
Oh
so
my
desperate to do it, they
God.
get a loan. They mortgage on their houses just to get
No,
plastic surgery.
oh my
here.
God, no.
So it's not even
Priorities, please.
Oh.
like I have a cousin. She did have surgery here, and I'm talking like I come from a big family both sides. I've only known 2 people my whole life that had plastic surgery.
Wow.
One of them went to New York. She went to stripper. She said in a month she got a whole lot of money, and she didn't have any plastic surgery yet. And she get like from the tips and from the job. Then she came here and she came with like $12,000 or so. That way she was able to get surgery.
Right.
And then she get back to get that money back, but still.
Wow.
So it's not something cheap
Cheaper.
or cheap. It can be a breast reduction. That's something that's common. My sister had it. She had extremely huge. She had a reduction because of health.
Okay.
And now we don't get discount, not at all. It's too expensive. It's a fancy world. Yeah.
You mentioned sugar daddies.
Yeah.
Where are the sugar daddies?
I don't even know.
She's
I
married.
can't find
She
it.
doesn't know.
I don't even know. I was trying to find one. He tricked me. So this will help you with your lungs. This is very good to know the capacity of air that you inhale and exhale in your lungs. Also, another cool thing about this, since you have a tummy tuck, there's a high possibility that you feel a little bit tight, right? And you get a full tummy tuck, which means your muscles get all tied up all the way till here.
Well,
Did he did a full
no,
tummy tuck or just a mini?
Oh my God, you're scaring me.
Just no.
A
There's
mini.
there's nothing to be scared of. I thought it was a full. So
No,
this is a mini. That's
yeah,
fine.
I thought he like changed his mind in the
No.
operating.
I did
Okay.
apologize. I'm sorry. It was me. Okay, so this will definitely help you. Also, this helps to prevent pneumonia, and with people with respiration issues, this is golden. And this is yours, so you can take this home and you.
Oh, beautiful.
Okay. The way that it's used is you gotta inhale. Do this to make the balls goes up, not exhale. So you just breathe normally, then put it in your mouth. Inhale. It's okay if not all three goes up the first time. Okay. Here it is.
I had a question about like the blood and stuff. This is from the fluids, or am I?
Like bleeding, you mean? Or
Yeah,
something?
like
No.
what is?
So lipo, imagine lipo, like this is my skin, right? When they do lipo, it creates some sort of space that it was not there.
Right.
So that's why they need the faja. So that space gets all tied up and gets like all attached to your, I'm not attached, just to get like, or
Yeah.
all the space gets, your body reacts it and fills it up with fluid. It's just a natural reaction.
Okay.
And that fluid is the saline that they use for lipo, blood, lymphatic fluid, fat. So they put a drain while the faja is compressing, you get all that fluid out.
Okay.
So it's a good thing that that is coming out.
Okay. Awesome.
It's not, you're bleeding on purpose, but you're bleeding bad things, which should be out. If you leave that fluid there, it's gonna hurt you a lot.
Okay. Thank you.
Yeah.
Guys, the doctor just showed me my table pics. And I can't stop crying. I look so beautiful. It's such a good job.
Hermosos resultados de esta bella paciente. Ella estaba preocupada por sus caderas. Miren qué bonitas caderas le colocamos. Esta que está acá, pielecita, cuando se retraiga. Miren qué cintura tiene nuestra paciente. Un bonito contorno glúteo. Muy bonito resultado. Esta mariposa creció. Ahora tiene alas nuevas. Muy bonito resultado.
Please move. Cover your boobs with your hand, please.
Ponerlo todos los días, a cada vez que le quiten la faja, ponerlo en la parte donde tiene unos moretones en los costados.
I'm on my way back to the recovery house now. The masseuse was saying I have a lipo burn in my back. So I asked her to make a video so that I could show it to my nurse at the recovery house. As good as this looks, I have no appetite.
Are you gonna do something on the other one? I'm come back, okay?
This looks so good. Right now, I am the definition of starving. This is the other side of surgery they don't warn you about. The side effects from the anesthesia, the constipation, the diarrhea, the stomach pain, the cramps, the headaches. So much.
I had to cancel my massage today because I've just been running to the bathroom all day. I can't even wear my faja. Like, it's so bad. And then I have the worst back pain. This is way too much symptoms for my liking.
Today is just a sad day to be a foodie. I asked the nurse to place an order for Imodium and Pepto-Bismol for me. I'm so hungry, but nothing is staying down. Okay, so this is what the chef make for me. For my upset stomach, I have plantain, I have pieces of chicken, I have vegetables, potato, pumpkin, carrot, broccoli. Muy delicioso. And for my upset stomach, the pharmacy bought electrolytes, Pepto-Bismol, Imodium.
I'm heading to my final oxygen therapy session. And if I'm being honest, I'm not gonna say that the sessions aren't beneficial. Obviously, we're not always aware of our breathing, but we know, of course, oxygen is vital and it's literally the line between life and death. So yes, I do believe that there are benefits of the oxygen therapy. However, I just don't feel anything. I don't know what I was expecting to feel. Maybe my expectations were too high, but I don't feel anything. This morning when my nurse was cleaning me, she did notice that my bruising went down a lot. And I read that that is actually a benefit of oxygen therapy. So maybe when you're looking at benefits for oxygen therapy, you should focus on the healing as opposed to how you feel. I still don't have an appetite, but my nurse told me if I ate my dinner, then I could get some ice cream. So here I am. Me, my nurse, and my roommate are up on the roof. I just wanted to walk up here and get some fresh air, get my blood flowing. Feels nice today.
Freaking threw up myself. I'm so mad.
Look. Pretty cute.
It hurts so bad. Like it's burning. Like maybe Saturday I noticed, and I bought a new pillow today because I thought maybe it's the pillow.
Maybe.
How often I have to clean it?
1 per week.
Okay.
And then when it heals like a little bit more, every 2 days.
Okay.
This is the cream that Dr. Laura is applying to my mini tummy tuck scar.
Miss Elizabeth, infectious disease specialist. Infectious disease specialist. Hi, how you doing? In pain, I know.